Good morning, everyone. Welcome to the February 2025 ChamberCast with the Monmouth Regional Chamber of Commerce. My name is Terrence Wall. I'm honored to host such a fantastic panel, and particularly all the folks that are here sharing their time today, and also streaming online. This is streaming live. Feel free to share, post, because today we're going to create what I call the ripples in the pond. We're going to save lives. If you think this meeting isn't important, wait until the end of the information and everything that you hear today, and everyone's going to realize, my God, this was a life-changing meeting, either for myself or my family or my friends or people I care about, because the content you're about to hear is incredibly important. Today and February is the American Heart Health Month. We have a fantastic lineup. Before we get started, I want to thank Bell Works and Ralph Zucker, the visionary of Bell Works and the fantastic venue that we're in here today. Our today's business sponsor is WISP Technology. I want to thank you to WISP, and we're going to hear more about them later. And also want to thank you to Ferrugia Cares for the healthy food drive for lunch break. And if you have any donated items, please donate them. I want to thank Dr. Ferrugia and his team for the Ferrugia Cares program. Today we have with us Hackensack Meridian Health, Jersey Shore Medical Center, Chief of Cardiology, Dr. Brett Sealove. Thank you very much for being here. Hackensack Chief of Surgery for Bayshore Medical Center and Director of Thoracic Surgery for Riverview Medical Center, Robotic Surgery expert, Dr. Ziad Hanhan. And also founder and president of TeamLife, Lifesaving emergency products and training expert, Jim Schatzle. Give them a round of applause, folks, please. We also have with us Cindie Dnistrian. She's going to be sharing her inspiring journey as a survivor of major heart failure. She's going to share with us her personal story and explain from a woman's perspective how symptoms presented themselves leading up to her near-death experience. Going to share her new heart healthy life tips and her successful journey overcoming adversity and getting back to healthy. So Cindie, thank you so much for being here as well. And Steve, her fantastic husband, is here as well. Now, I would say we have such a great group that it makes my heart all aflutter, but they'll probably give me a diagnosis of SVT or cardiac arrhythmia or AFib, so I'm just going to say we're really glad that you're here today. We're going to open it up to everyone that's here. We have a lot of folks here, but we want to make sure that the folks that are on this panel also know who you are, so you can share your name and your company, and then we'll jump right into all of the fantastic content you're going to be here today. As we get to the folks to introduce, remember, Monmouth Regional Chamber does several events a month. If you're not already a member, make sure you're a member. This is the chamber you want to be a part of. Thank you very much. Jeannie.
All right. Good morning, everybody. Jared Logan, owner of Go for Hire Staffing and Freehold. We help you find qualified people for work in any industry.
Hi, my name is Sebastian Stolzenberger. I'm a Homedale resident, and I have a background in fashion design, and I'm involved with the Homedale school system and the parent associations.
Thank you. Yeah, hi, my name is Christabel Rosal. I am a branch manager for First Commerce Bank in Freehold.
Welcome.
Hi, I'm Matteo Di Rugoli. I'm a regional sales and service officer for the First Commerce Bank.
Welcome.
Gary Gelman, Gelman Images, full-service photography, video production. Today we're at Bell Works Friday. I'll be photographing the President of the United States.
Woo!
Did I say vice? I meant Vice President. Did I say President? Vice President.
Vice President. And we want to give a shout out and thank you to Gary. He did a beautiful promo last time. We really appreciate it, and another one is coming today. Thank you, Gary Gelman, Gelman Photography.
How are you? Hi, my name is Kathy Kamatani. I'm a marketing consultant. I'm working with FDU. We have a new program here at Bellworks, an MBA and certificate program.
Thank you.
Hi, I'm Gail Bonus. I'm the administrative specialist with the Monmouth Regional Chamber, and it's great to see everyone here today, and thanks for coming.
Hi, everyone. My name is Therese Rolke. I'm the executive director of the Monmouth Regional Chamber of Commerce. It's great to see so many faces here. This is going to be a great panel, and we'll talk later. Thank you.
Hello, everyone. My name is Ashley, and I am in marketing at Seaview Orthopedics. We're everywhere and serving the Monmouth, Ocean, and Middlesex counties, but nice to meet everyone. Hello.
Thank
Welcome.
you.
Good morning and happy Tuesday, everybody. Joseph Marone, residential and commercial mortgage broker, Go Rascal, located right in Red Bank, New Jersey. Thank you.
Good morning, Alex Neal. I am a Thrive After Divorce coach, which means I help women who have gone through divorce to pick up the pieces of their lives.
Hi, everyone. Vice President of HR Advisory at Atrium, right here in Bellworks. My name is Joanna Chavers, and this is my first meeting. Happy to be with you today.
Welcome.
Good morning, everybody. I'm Tara Demianovich. I work for Community Affairs and Resource Center. We help amazing different programs for the community. We're having a gala on May 9th celebrating awesome honorees, including our Maureen Lloyd. She's our Humanitarian of the Year.
Woo! Good morning, everyone. My name is Dorothea. I'm Zando Financial, which is a full-service female-owned financial planning firm located in Monmouth County. I'm also the co-founder of the Victor Zando Foundation, which is a local nonprofit. Thank you.
Good morning, Bonnie Preston. I'm a certified insurance counselor in commercial and personal property and casualty with Conover Buyer Associates.
Thank you.
Good morning. I'm Christine Minorchenko. I have an interior design business in Wall.
Hi, my name is Paul Thurston. I'm owner of T Marketing, and I help businesses deliver an outstanding customer experience. If you need help with that, let me know.
Thank you.
Good morning. I'm Ann Mohammadi. I'm on the board of the Monmouth Park Charity Fund and co-chairing the Kentucky Derby, and we're honored to be recognizing Bob Garrett and the Hackensack Meridian team.
Wonderful.
Thank you. And that event is on May
3rd.
May 3rd.
Good morning. My name's Angela Ashley, and I'm the Regional Director of Development for Acela Healthcare.
Good morning. Linda Sirico, Comfort Keepers Home Care. We serve Monmouth, Ocean, Middlesex County. I also serve on the board for Monmouth Park Charity Funds.
Good morning. My name is Rosie. I'm from CSAV Systems. We install commercial sound and video systems. And I also am here promoting the president of our company just released his new book, Everything to Stand. It's about his battle with cancer. All proceeds are going back to charity. So if you're interested, you can touch base with me or my colleague, Teresa.
And I think that might be next month's podcast, yes?
Yes, next month we're doing a podcast on authors and how to author a book, and Glenn is one of the guests.
Yes.
Thank you.
Hi, good morning. My name's Teresa. I'm also with CSAV Systems, so we're based in Colts Neck, and we integrate audio-visual systems like video walls, digital signage, anything like that for business.
And if I'm not mistaken, you do work for Hackensack Meridian, right?
Yes, we do.
Okay, see?
Yeah, well, thank
There
you,
we-
Terrence. We do a lot of work for Hackensack Meridian, video conferencing systems. I'm Steve Dnistrian. I'm also with CSAV Systems.
You're Cindy's husband.
But most important,
That's who you are. Most important.
importantly, today and every day is that I'm Cindie Dnistrian's husband, and we're here to share Cindy's story and our wishes that no family has to go through what we endured, but we're happy that she's here with us today.
Thank you.
Well said, thank you.
Hi, good morning. My name is Jasmine. I have a studio in Aberdeen on 34. I do eyelash extensions, lifts, and tints, and I would love an opportunity to earn your business. Thank you.
Hi, good morning. My name is Joanna. I am the Director of Nursing for Caring for Angels. We do non-medical and medical care. So if you need your loved one to be taken care of, please give us a call.
Hi, good morning. Bridget Irvin. I'm with Senior Care Authority. I help families with a no-fee concierge service when they're looking for senior living, community assisted living, or memory care.
Thank you.
Good morning. My name is Howard Stein. I'm the owner-operator of Home Helpers in Freehold. We provide nurse-supervised non-medical home care in Monmouth, Mercer, and Burlington counties.
And this is your 5-year anniversary, Howard, right? Yeah, congratulations.
Congratulations, Howard.
Hi, good morning. I'm Erin Ferrugia. I am the Director of Mid-Level Practitioners for Advanced Heart and Vascular of Central Jersey, also located in Colts Neck, and I'm happy to be here.
Yes, and you remember Dr. Ferrugia. He spoke last year at Heart Health and the year before. So, yes, say hi to Dr. Pete.
I'm Kevin Butch. I'm here with Bryn, Sal, and Andrew from Maz Recycling. We do all waste and recycling as well as mulch and all construction dumpsters. You know, it's great to be here. We've been here over the past few months. We're having a really good time. We're excited about being part of this.
Thank you.
I'm Bryn Masello. I'm the marketing director for Mazza Recycling, here with these sales guys. My first Monmouth Chamber event, so happy to be here. We just opened a transfer station out in Philadelphia, so that's been some exciting news. Check us out locally, check us out down in South Jersey, and now outside of Philly as well.
And they have great merch. Love those jackets.
Good morning, everyone. Sal Folletta, Director of Sales for Mazda Recycling. Just here with the team. Thank you for having us, and looking forward to the podcast.
So John Idelson, Game Day Men's Health. We're located right off of 35 in Homedale. So we are a elective men's health facility. Basically, at Game Day, we create hard men, hard minds, hard bodies, hard everything. So, ladies, if you think your men's gone soft, let us know.
Hello, everyone. My name is
You're
Drew
gonna be busy.
Falcone. I work with Mazda Recycling, take care of front-end containers. If you guys need any trash and recycling needs, reach out to Kevin, Bryn, Sal, or I. Happy to be here.
Good morning. I'm Roseanne Sophie. I'm with Community Magazine in Monmouth County. We are kind of in startup mode with a new owner, and we have 6 magazines that go to 62,500 homes and businesses a month. I'm the Director of Sales and the General Manager, and if you need to get your business out there, give me a call.
And who's the new owner?
Vingo Pal.
Oh, okay. He owned it before. That's why I was confused. Yep. Okay, thank you.
Good morning. My name is Elliot Cohen. I'm the internship coordinator at Homedale High School. If your business is looking for an intern a couple of days a week or a job shadow, please touch base with me afterwards. We have amazing students at Homedale High School that would love to help your business and learn at the same time.
Yes, thank you for the program that you implemented. And how many internships are there now?
This year, we have 28 seniors out of maybe 175 that are graduating this year, participating in internships all over Monmouth and Ocean County. We have some in Bellworks. And I want to really thank the Wall family. They've made a lot of connections for our students and given them tremendous opportunities in a wide range of fields, from medical to photography to film and a whole bunch of other things. So definitely touch base with me after the meeting. We have a great group of students that would love to help your business.
Yeah, and I have to tell you, the feedback on the interns is incredible. So they're doing a great job. Thank you.
Hi, good morning. My name is Madeline Tasillo. I'm a junior at Homedale High School. I'm interested in pursuing a career in nursing, and I would like to find an internship or job shadowing.
Good morning. My name is Gabriella. I'm also a junior at Homedale High School, interested in pursuing a career in the medical field, and I'm also looking to job shadow or find an internship.
No pressure, no pressure.
Hello, my name is Valerie Khalil. I'm a senior at Homedale High School, and I previously interned at a cardiology office. So I'm looking for another internship, and I'm looking for a career in healthcare in the future.
There we go. Great. Thank you.
Hi, I'm Teddy Wall. I go to William R. Sat School here in Homedale, and I'm here to learn about heart health.
Thank you. And this is my son, our son. Thank you.
Welcome.
Yes. And let's hear it for Ming from A Shared Universe podcast. Woo! And I'm Jeannie Wall, the owner of Hometown News, publishing for Tap Into. I have about 40,000 different readers a month all over Monmouth County, about over 70,000 a year. And it's a great platform for telling your story and all of your marketing needs. Thank you.
Awesome. Thank you. Thank you, everybody. And I do want to have a shout out to Hackensack Meridian Health. Their team, their collective outreach, and I hear Maureen Lloyd and dear John Lloyd, one of the pinnacle leaders in that space. Really just a legacy of love with the healthcare field. But thank you to Hackensack Meridian Health and your community outreach and really building such a fantastic team in the state and really and even beyond. So thank you. Before we dive in, I want to thank today's business sponsor, Wisp Technology. It's the world's smartest QR code. You grow your business effortlessly with Wisp Smart QR to SMS technology, capturing contacts instantly. No forms, no waiting. Wisp makes real-time engagement easy, removing obstacles, enabling immediate action, and building customer loyalty through seamless, personalized interactions. With Wisp, take control of your customer relationships and build a contact list you own while maximizing every marketing dollar. Check it out at wisp.io. That's WHISP. .io. You know, we all have stories, right, and different things of life. And when it comes to the heart, it's Valentine's cards, it's the mystery, it's love, and it's also muscle that's providing you life from birth, and it's an enigma too, and it brings such curiosity and fascination over the years culturally in so many different ways. And what's so important is that we protect it. We're with our bodies a certain amount of years, but oftentimes do we spend that hour to protect that body that's protecting us? And it's such a small investment in time. It's such a small investment to say, you know what, let me put myself first so I can take care of everybody else. The analogy of the reason the oxygen in the plane drops down, put it on yourself first so you can take care of everybody else. And that's one of the messages that's going to, it's going to come out today. So, and we all have stories. Like for me, I was on a computer. My heart rate goes, about 10 years ago, it was about 220 beats a minute. I'm in the kitchen thinking, what should I do? I'm thinking, I'm not going to die in my kitchen. I was on a computer. I called Jeannie. I said, what do you think? Should you call 911? Which I'm a no. And I said, maybe. So that didn't go over very well with her. But pretty soon, I'm set up well for the medics. I'm laying down. They thought I collapsed, but I was just getting prepped because I was on the first aid squad with you. And I'm getting hit with adenosine. I had supraventricular tachycardia. And not too long after that, I'm in Hackensack getting a cardiac ablation. Perfect. Everything went great. Very fortunate, very lucky. And I count my blessings for that, because we all either have stories or we're friends and family that have these different stories. I'm sharing mine just because we should put it out there. And so this segues into our tremendous appreciation for Cindie that you're here to share your story, which is incredible, and it's about life and love and more. Can you share your story? And then what we're going to do, we're going to get into the folks that'll resonate with you, because you're someone they see, and you're someone that they help, and they help ensure survival and life and fitness. So would you mind sharing your story? We'll start off there, and then we'll start working our guests.
Good morning, everyone. Hear me? My name is Cindie. I'm coming up on my 3-year anniversary. It'll be the end of March, so I feel a little emotional today being here. I think. Me too. So bear with me. 3 years ago, March 25th, I went to work. I had 3 children. My husband and I. He went to work. And I worked for a doctor's office at the time, and all day I had shoulder pain, significant shoulder pain, but we were doing a lot of computer work, and I just, over the course of a couple of days, and so I just felt by leaning over and I kept kind of stretching and all day, and to the point where I was kind of joking with my coworker saying, heart attack is down a left arm, right? It's not, And they're like, oh, don't say that, don't say that. Well, meanwhile, I had just been to my regular MD. My cholesterol was fine. I had gained weight through COVID, wasn't exercising. So in retrospect, looking back now, I know I was winded. Going up a flight of stairs, I was winded. I was tired. I was exhausted by the end of the day. But I also attributed that to working hard and managing life. Anyway, came home that night. We were going to, it was March Madness. We were ready to watch the basketball game, and again, still had significant shoulder pain. And I said to my husband, could you just massage my shoulders? I'm really, really sore. So he did, and it helped a little bit. But within a half an hour, I said to him, this is getting worse. Like, I am in such pain. I really think you need to take me to Jersey Shore. We're in Colts Neck. It takes 20 minutes. And he's like, really? Like, what did you do to your neck? Like, we're thinking it's a pinched nerve or something in my neck. Never, ever thinking heart. Got my things together. He said, should we bring an overnight bag for you? And I'm like, I'm coming home. And that was it. Had we waited 10 minutes longer, I wouldn't be here with all of you. So we drove to Jersey Shore. Halfway through the trip, 10 minutes in, I could hardly breathe. I couldn't talk to him. I was kind of hyperventilating, I think. We got there. They brought me immediately into triage. All I remember is them setting me up with an EKG. The nurse, and I remember looking at her, and she pulled the paper off of the EKG machine and ran. And that's all I remember. And I went down. My husband was still in the waiting room, watching the March Madness on his phone when he heard a code being called. And it was change of shift, so there were tons of doctors there leaving and tons of and staff coming, and they were all running to my room. He didn't know it was me. The nurses came out and said, you need to come with us. Your wife is critical. Meanwhile, I had lost my heartbeat. So I was down for 12 minutes without a heartbeat. They had done the paddles twice on me. Obviously, all kinds of medication. They brought Steve back, obviously not to me. He sat outside the curtain, and all he remembers is people running in and out, running in and out, running in and out. All I remember prior to going down was them saying, "Oh my goodness, she's so young." I was 57, and that was it. I had gone down, I had 100% blockage in one of my arteries. They rushed me to the cath lab, where they were able to put a stent in for me. But they didn't know I was in an induced coma, and I was in the cardiac ICU for the next 24 hours, and they had no idea what my deficits would be at that point. I had been without oxygen for quite a while, so they prepared Steve. He had the horrific task of calling our 3 children to tell them where Mom was and my family. The next day, they were going to I was intubated, so they were going to start to reduce all the medication that I was on to try to bring me around, and they told him to prepare yourself, we just don't know. And luckily, here I am. So thank you. You know, it was a couple of weeks at Jersey Shore, and I attribute my life to them. They saved my life. My husband saved my life by saying, "Okay, we're going right now." Had we waited 10 minutes, I would have died in the car. So to come back from that was pretty amazing. And when we were in the ICU, and I always tell this story, I'm sorry, Steve, I knew, like, I couldn't move, but I could hear the beeping and the sounds, and I knew it was something significant had happened to me. I didn't know what. And so I was trying to write on his chest, ICU, am I in the ICU? And he says to me, "I see you too." And I said this to him, and he said, "She's going to be fine," to the doctors. But anyway, I mean, I could laugh about that now, but it emotionally, spiritually, physically, it was a very difficult recovery. I had 9 broken ribs. I had aspiration pneumonia from the compressions for 10 minutes on my chest. But I'm back. And changed everything. I was a person that always said, fish, no thanks. I don't like it. And now we have it probably 3 times a week. Exercise more, eat healthy, all of those great things. And I tell my story. I tell my story for men and women, but right now I'm going to focus on women in that we tend to put ourselves very low on the list in life, and we can't do that. We're in between taking care of our elderly parents, and at the time my dad was dying of Alzheimer's, and Mom in a wheelchair and running to Connecticut every other weekend. And then my 3 children who were in college at the time. So we kind of are in the middle of that, and you know this feeling, and you have a pain or an ache, and you think, well, I'll go tomorrow, I'll be okay. You know, now, and I did all the I did go to doctors and that sort of thing, but I didn't run at every little thing. And that's something normally, maybe that day, I don't know, divine intervention, or it was so significant that I said I better go. But normally, you know, I might have said, you know what, I'm going to get a heating pad, I'm going to lay down on the couch, I'm just going to relax a little bit. And I wouldn't be here to tell the story. So my story for all of you is to get your heart baseline, go to a cardiologist and see where you are. There's calcium scores, there's all of those things. I had no idea that I was so close to having a heart attack. I had no idea. In retrospect now, there were some subtle signs. Also, my mother has heart disease in the family. And I've learned since, really, even if you're doing everything right, big factor. And didn't realize that at the time. So Since that point, my younger brother at that point, I said, you need to go and check yourself out. Mom and dad, or mom has heart problems. I just had this. You need to go. And sure enough, he went for a calcium score. They didn't like the way it looked. They took him into the cath lab. He had a 99% blockage. He was 54 years old. They did a stent, knock on wood, he is absolutely fine. So since I've told my story, I've had so many people come to me and say, I went, I listened to you, thank you. So that's why I'm here today, and I hope that it helps one of you. And I will just say one more thing, that's great. I'm so thrilled that I'm here today because since that point, 3 years ago, our oldest daughter has gotten married, and we're expecting our first grandchild in July.
Well, congratulations, that's
So,
awesome.
Thank you.
And that's really only part one of the story, and that because I want to bring it to our other guests because the recovery piece is extremely important, and then where do you go from there? But going back, and thank you so much for sharing that story. Coming back a little bit for the team here and TeamLife, Jim. What's happening there? Now, every situation is different. Okay, acknowledging that. Okay, but from a physicality standpoint and the technology that may or may not be available, what's happening there? And then move into, and this is for folks, jump in however you see fit. From every situation is the specific. So this is speaking generally. But what are the types of mechanisms that are in play for folks with this kind of presentation? If you could start with the technology piece and that 10 minutes, right, it's 6 minutes. If you're down for 6 minutes, that's it, right? So talk about that and talk about what's happening with the body at this point, because it's either plumbing or electrical, right, or both. So
I appreciate it. So the story all comes into play about where she was when it happened. So I love that you bring up the different symptoms between men and women. So as a paramedic of over 30 years, right, men know how to have heart attacks, right? We'll have a myocardial infarction, we'll complain about it, we'll sweat, we'll vomit, we'll be like, oh, this pain is horrible and stuff. Women go, I don't feel right, and then take care of the men in their lives and don't do anything about it. So we need to act on it. That's important. I'm glad this didn't happen in this situation, but the situations where you're not in the hospital, and then your heart stops out of the hospital there. So one of the things that I want to bring to all of us today and people that are watching us is take a little time and find out what would you do in that circumstance, right? Did you ever take CPR? I did, but I think I remember it. So maybe you need to go ahead and renew your CPR class, and if you've never taken, you definitely need to do that. There's also unbelievable technology that we can have available to ourselves. So think what you have available at your workplace or your home. Do you have a first aid kit or kind of like an old box of Band-Aids that you think are there and maybe they are and maybe they're not, maybe remember where they are? You know, do we have more than that? These days we can get great first aid kits because there's two things that really take life away very quickly. When your heart suddenly stops and nobody's there to do CPR or to apply an automated external defibrillator, or if you're bleeding really badly and we can't stop it. So you have devices and things that you can get for both your workplace and your home that if this happens, you have something to go ahead and work with there. So Terrence, we know this, right, from the EMT paramedic days, is that 1,000 people a day go into sudden cardiac arrest. It happened yesterday, it's happening while we're doing this podcast, and it's going to happen tomorrow. 1,000 people every day, only 5 to 7 of them percent survive. So we need to keep on talking about this, keep on educating ourselves, and I appreciate that.
Thank you for that. Dr. Sealove, what are you seeing out there? How do these things present, different for men and women? What would you like to share for us?
Yeah, well, if I had another 3 hours, I would love to really take that question and do a deep dive. But first, Cindie, it's spectacular that you're sharing your story. It's spectacular that you're here. I do give some credit, not just because us men want to stick together, but I do give some credit to your other half, because most of the time people would tend to probably ignore it, on the other hand, you know, the receiving end. So it's great that you all collectively made a very, very good decision. I mean, the reality is that this story, unfortunately, I hear every day, literally. That's not, you know, kind of semantics. It's, and I would probably say the few things that I would highlight is historically, like Jim mentioned, this is still the stigma that this is more of an old man's disease, and that is, we're working, I think, pretty well over the last decade and making sure that stigma is going away. But we still have a lot of work to do. The other thing I would really highlight is that, what you mentioned is that women typically present a little bit more with non-classic symptoms. That doesn't mean every time you have an upset stomach you need to run to the doctor or call your cardiologist, but I would just listen to your body. When you know that something is just not right, it really is actually more of awareness and education that is really what the grassroots is all about. Because if you don't, something tragic can happen. And even if anybody was there or a defibrillator is there, if it happens outside your home, it's not a fantastic outcome typically. Speaking of which, knowing your body is important. Historically, roughly 70 to 80% of women actually have a subtle symptom that they look back on for the 30 days preceding to their event. And say, wow, I didn't realize that was my heart speaking to you. And I think that's also really important, predominantly because the first presentation of heart disease, 50% of the time, that's with a 50, is sudden cardiac death and arrest. So we don't typically, sprain your knee, hurt your knee, and then now, I really need to see an orthopedist because my knee is really bothering me. Some of the warning signs of heart disease are your first presentation of something tragic. So, I think right now it's about awareness. I think somebody in this room will somehow go home, talk to your friends on a Saturday night, and it's gonna ring an alarm bell in their mind, or talk to their loved ones. And really, it's just about awareness. It's about knowing your numbers, knowing your body, speaking to your healthcare team, I would argue, not just your cardiologist. But yeah, your story is amazing. I am thrilled to be a part of, this, and, again, kudos to you.
Thanks, Doc. Dr. Hanhan.
Very, very insightful story, and I hopefully people can benefit from it. And I think it's sometimes difficult to figure out, is it something that I have to seek help with? But if it persists, and I think you have to look at the heart as a pump. So it's not just classically chest pain. If you feel like you're short of breath, you can't go up a flight of stairs. And I think what Dr. Sealove mentioned, just listen to your body. I think most people get a sense that this is like an impending sense of doom, as described a little bit, like something catastrophic is about to happen, and listen to your body. And I don't know if we want to get into the unusual cases of chest pain, but
dive in.
Okay, you want me to? All right. So
also touch on the robotic surgeries. Up to 700 robotic surgery, right?
Right. Yeah. So I did do open heart surgery. I started my career in 2006 at Jersey City Medical Center. So I did about 5 years of open heart. At the time, I shared a story with Terrence, and basically let me set the stage for you guys. So here I am as a young surgeon working at Jersey City Medical Center, and taking call for the emergency department. And they call me to go see a 29-year-old woman, Jessica, and she was 26 weeks pregnant. And she had severe chest pain the night before and came into the emergency room. So they did an echocardiogram, and on the echocardiogram, it showed that there was a tear in the aorta. So the aorta is the largest blood vessel in the body. So when the heart pumps, it pumps blood through the aorta. And if that tears, a lot of times it's lethal the moment it tears. Some patients survive and they get to the hospital. Not to scare folks out here if you have chest pain, but this is described as typically the most horrific pain you've had. It's almost like if something is tearing on the inside of your body, which it is. And it radiates to the back. It's the most excruciating pain you probably ever felt. Just to kind of to reassure people, it doesn't happen that often. There's only maybe 8,000 cases of aortic dissection in the whole country on an annual basis. So it's very rare. So we're going to talk about common presentations, but I wanted to talk about uncommon presentations also of chest pain. So in aortic dissection, even some emergency room doctors don't think of it because it's so rare. In this particular case, I was dealt with a patient who was pregnant, and I had to worry about if I take her to the operating room, and the operation has a mortality rate of about 30%. So if you take somebody, this was a mortality rate of 200%. If the mom didn't make it, and this was her 4th pregnancy, and if the baby didn't make it, then that would be a catastrophe, that most doctors are not faced with. When you work in a smaller medical center. It was only myself and another surgeon, excuse me, and then he happened to be away, of course. So it was just me looking at this problem, and what I figured is let's at least get the baby out. If we get the baby out at 26 weeks, then the baby has a chance, and if the mom doesn't make it, then the mom, I'll do my best. So I called the OB guys, they show up, 3 surgeons show up to get the baby out. I'm thinking to myself, it's a routine C-section, and really the problem is not the C-section. So anyway, there were 3 attending surgeons doing a routine C-section, so they get the baby out, and then this was up to me. Now, mind you, this kind of started around 5 p.m. We started with the open heart operation. I had to open the chest. I had to basically put the patient on the heart-lung machine. Also, for this particular operation, we have to turn the heart-lung machine off to do the operation properly, which means that essentially the patient's clinically dead. And in order to do that, you have to cool the body and protect the brain. So we did all this, did the operation. When I opened up the torn blood vessel, it looked like the tear extended to the main blood supply to the heart. And so when I took the clamps off and I thought I was done, 8 hours in, 9 hours in the operation, the heart didn't look like it wasn't really beating properly, and it wasn't perfusing. So then we had to get vein grafts from her thigh, I had to do a double bypass on her to restore blood flow to the heart. So 14 hours later, right, the heart starts to beat appropriately, we dry up the bleeding. I didn't know if she was going to wake up and be neurologically intact. I didn't know how the baby was going to do. She wakes up, she's moving everything, there's no deficits. The baby makes it. It's a big success story. The hospital's all buzzing about this story. And so I think Jeannie was kind of, from 15 years ago, mind you, she still brings up the story. And she goes, oh, would you share the story? So it's just a kind of a compelling story, but also not a common presentation. But it boils back to listen to your body. In this particular case, I think if you have an aortic dissection, it's not something usually let you sit on, and it typically happens in men above probably 70. So not to scare, but it's nothing that people will sit there and say, oh, I think I'll sleep this off. I mean, it's a significant debilitating pain. The other thing that I was going to talk about is a more common presentation of chest pain. Hiatal hernias. So now, in my current setting, I don't do open heart surgery anymore. Hiatal hernia can mimic chest pain. I'm sure, Brett, you've had patients who would call you, and as a cardiologist, if they call you and say, I'm having chest pain, and even though you know they have a hiatal hernia, you're going to say, go to the emergency room, because you don't want to take a chance that it is the heart. So I've probably operated on 6 women that have had that presentation, where a hiatal hernia, so part of the stomach, goes up into the chest through an opening, through the diaphragm. The diaphragm is the muscle that separates the 2 body cavities. And so it's very common as one gets older, probably about, I would say, probably half of, especially women above 60 to 70 have them. And it could be something that starts off as a small hiatal hernia that's very common. The ones that I fix are the larger ones, so where a good bit of the stomach, maybe a third or half the stomach's up in the chest. So it causes pressure, it causes discomfort, heartburn, difficulty with food, actually keeping the food, from going down into the stomach, and sometimes spontaneous vomiting. And so we fix these, as Terrence alluded to earlier, we fix these robotically, and it's a night and day difference, and the patients are typically very happy after it's been done.
Thank you for sharing that. A lot of folks think that they're perfectly healthy, everything's great. They're too busy. I'm too busy. I'm fine, everything's great. A great friend of ours and one of your partners in care, Dr. George Giannakopoulos, was infectious disease specialist. He was on podcast recently. What this gets to is, what are some of the tools and techniques that people should be thinking about right now? Calcium scoring, understanding the myths and facts of statins and things like that, because his amazing wife suggested that he get, I believe, a calcium score, right? Mary, yeah, of course. And he got one. And he shared the story publicly. He had major heart surgery. I think it was about a week and a half. And he was on here sharing that story. And that's why it's so awesome to hear these stories shared. And that was through the calcium scoring, which heretofore hadn't been so commonly discussed. Can you talk about some of the things that you would say, hey, folks, do this right now, or do this? Even the people say, listen, I'm at the gym every day, like that strong guy over there with that bulldog, right? Did you get a calcium score? Well, maybe you did, maybe you didn't. Can you speak to that a little bit and unwinding a little bit of the mysteries of statins and things that people hear about but don't really personally connect with?
I'm assuming the strong guy and the bulldog, you're referring to me, but I don't have the bulldog.
We're going to get that pooch over here.
Well, first, let me spin this a little differently, and then I'll answer your question. I mean, one thing I think everybody needs to think about and realize that 70 to 80% of heart disease is actually preventable. And I would really, if you're going to think of anything that you should take away, is that statement. It's just really hard to do those things on a continual basis. And you said something interesting, you know, you only have one body, one engine. And if you did have one car for your entire life, not only would I not allow my teenagers to eat in my car or do anything in my car, but the reality is every time you put a little, maybe unleaded gas, or you don't really get your oil change regularly, nothing's going to happen to your vehicle. And the reality is if you only had one vehicle to get you from birth to the end, my suspicion is you would really be pretty careful about every aspect of your car. And unfortunately, the engine that sits in your chest, it's sort of out of sight, out of mind. And, the constant barrage of risks that it sees on a moment-by-moment basis aren't really contextualized. The reality from, poor food, poor health, exercise, cholesterol elevation, whatever it may be, it's not going to likely change your outcome today. Your Saturday night meal is not going to change your outcome Sunday, historically. But routinely, constantly having that risk surely could. It's no different if you put unleaded gasoline in your car, the cheapest version. Nothing's going to happen to your automobile. But if that's your only engine for life, it's something that you probably would reconsider doing on a regular basis. So first and foremost, the spin is this is not going to affect you today. That's the plan. The problem is it's the number one killer in the Western world. So none of us can get out of Dodge without any risk, self-included. So there are a lot of things you can do. A calcium score happens to be one of them. That is a very, very low-risk screening test. It's a few x-rays worth of radiation in your chest. It's about as much radiation as a mammogram. There's no IV, there's no contrast, and it looks at the calcification on the outside of your arteries, which is from a process on the inside. Not everybody needs this test. But it's an incredibly helpful tool to kind of literally look under the hood of the car, going with the car analogy, and seeing how that engine physically looks. Don't forget, I don't know what it is functioning as, but it's a look to see how the engine is doing.
It's only about $100, right?
Yeah, it's about $49 to $99, typically out of pocket, although insurance companies are paying for it because now it's in the guidelines for stratifying heart risk. But yeah, it's an incredible prognostic and diagnostic tool that a vast majority of us should have as a means to color the picture. It is not the only test you need. It's not, if it's normal, I could do anything I want kind of thing, because it answers a specific question, but it does add a lot of value to your risk. Now, the last question, you've asked it about statins. The reality is that we probably overprescribe statins in the world. That's probably a universal statement. They're all generic now, so the concerns are that, it must be coming from pharmaceutical companies. That is probably, in my opinion, a fallacy, because they're all generic. And we overprescribe certain things, but in the right setting, drugs like statin therapy have been unequivocally proven to decrease the risk of heart disease progression, heart attack, stroke, and death. So if you choose wisely, physician, and if you choose wisely as a patient, it is a vast majority going to be improving your outcomes of things you don't want. So I am a huge proponent of it in the right patient, as long as you're selecting it and as long as you have a conversation with somebody about the risks and benefits. The risks are incredibly low, and the benefits, I would argue, are incredibly high.
And Cindie, how is your recovery, how does it dovetail with what you're hearing as far as whether it's medication or lifestyle or the mental physical connection of folks. And can you speak to that a little bit, of how you find that kind of stable place where you're comfortable and you're feeling healthy and strong? And what would you share with the men and women who are here, and the young men and women who are here?
I think diet is very important, obviously, and exercise. I am on a lot of medications since then because I did have damage to my heart, unfortunately. I think that it's important to talk about this and to make sure your family understands all of this as well. For me, I think having it in my family, I wish I had realized then that I should have been more on top of it. So now my children that are in their 20s, we have them on top of their heart care as well, because you just don't know. But in terms of the mind, I mean, I call it PTSD. I mean, whenever I get a shoulder ache, which is truly shoulder pain, I immediately go there. And that's hard, and that's something I tried to work on. I did go to a therapist afterwards just to talk it through, because all I did was cry. It was awful. I was so grateful to be alive, but I was terrified of anything. And that's still, like, I mean, March is coming, and that is in my head. And so that's there, and I try very hard to kind of keep that down. My husband's very good. He's like, okay, just, let's think about this. Like, I've got a blood pressure cuff at home that I check, and if that's okay, I'm like, okay. If I give myself 10, 15 minutes to relax, and I'm like, okay, this really is shoulder pain, or whatever. But it could be something as simple as that. And unfortunately, I don't know if that's something I will always have. I think so. It's something that has absolutely gotten better. I try to keep stress out of my life completely too, which is
Steve,
hard.
you gotta go.
Yeah, bye, honey. No, I do try to keep stress out of my life, and I think that was a big contributor. Like, I would get panicked about such little things, which I don't anymore. I just let it go. It's okay.
Let's pause there for a second. Talk about the mental health connection. We do a fantastic podcast on mental health for folks, and it really drives into it. Taking the stigma away, really talking about how people are doing. Can you talk about the mind-body connection a little bit here? Because that's incredibly important, isn't it?
Yeah, I could start by telling you, first, about 30 to 50% of people who have any sort of medical cardiac event will have anxiety, depression, or PTSD around your event. So, and it's real, and it needs to be addressed. It needs to be discussed, and we as a medical community need to do a better job in asking the right questions when that stuff happens, and the patient and their family need to also bring it to our attention, because it's unequivocally real. The flip side of that is people who have more anxiety, depression, and other mental illness also gets in this vicious cycle of having more heart disease. And that is about a 30 to 50% risk as well. And that typically becomes they're not eating as well, they're not taking care of their bodies as well, they don't have the motivation to do these healthy things. So you are in this vortex of a problem where an event could happen causing severe anxiety, depression, PTSD. That could also increase the risk for another event, and vice versa. So
stress and cortisol levels have an impact on cardiac?
For sure. Now, that doesn't mean, and this is what I said earlier, is that, anxiety and stress has a value in life. Getting away from the boar who's chasing after you 1,000 years ago was the reason. The chronic level of anxiety and stress in our society is the problem. And you're absolutely right. Kudos to you, because the fact that you just let things roll off your shoulders now is unequivocally healthy. And the reality is that nothing is going to change from an isolated, stressful event in the scheme of life. So we all need to do better at it. You're absolutely right. So chronically high cortisol levels, stress, is the problem. It's not having a big presentation in high school is not the thing that's going to be a deterrent to your health. But if we don't acknowledge this, something terrible could happen. And the only thing I will add to what Cindie mentioned, I am a huge believer that this is generational, that, your grandchildren, your children, everybody in the audience, everybody who's listening, when something happens or when this comes to someone's attention, you see mom or dad exercising in your basement and the kids are scratching their head and saying, wow, that's pretty impressive. Or, you know what, I'm not going to have that steak and I'm going to have a piece of salmon over, a bed of broccoli. Wow, that's, it is generational. Behaviors do change. It's not easy to change, but you really want to instill that idea in your youth. And because the behaviors begin at the age of 5. So it is important to start these things young. And if grandma or grandpa have an event, not saying you're there yet, but because I know you're soon to be a grandma, but what it does to your children and your children's children can be incredibly impactful.
And would you like to share, and Jim?
I'll just add, I think that was pretty much a pretty comprehensive answer, but I will add the role of genetics. And if you listen to the story pretty carefully, her brother ended up with a very similar blockage. So yes, of course, optimize everything with diet and reduce stress, but my favorite kind of part of the story, of course, of the fact that you're here, is that she called up her brother and said, hey, get your heart checked out. So obviously it runs in families. I think our parents show us kind of the way. And if your parents have issues with their heart, chances are you're going to have issues with your heart or your siblings. And I just love the fact that you got him checked out.
Thank you, James.
So mind-body connection is so important. One of the biggest things that I like to tell everybody I come in contact with now, don't postpone happiness. We have a tendency for this in our lives. If I get this done, I'll be happy. If I get this internship, if I get this grade, if I get into this college, if I get this job, if I buy this car, it just goes on and on and on. I'm sure there was times in my life where I waited to be happy. Those times are far gone now. Because bad things happen sometimes that even when we do everything right, there it is in front of us there, and we have to deal with that, and it changes our life in the blink of an eye, in the beat of a heart. So don't postpone happiness. Look into, if you like research, look into blue zones in our world. And you'll watch these people in those zones take care of their spiritual life, their physical life, their intellectual life, their relational life, and their emotional life. That's Spire, by the way. And if we address those, we're in much better shape.
That's exceptionally well said. Thank you so much for that. Before we open it up to questions, I wanted to, and then we'll get into closing comments, and also like to hear what's the next big thing for you folks and how folks can reach out to you or connect with you or a nonprofit that you care about, because we illustrate nonprofits on the Regional Chamber all the time. But Hackensack Meridian Health has geared, and you can either or both of you can perhaps answer this question or give us a little bit of the contours. They've really, the healthcare of today is so integrated than it was in earlier years, where it was more silos, where the physical and the mental and the emotional, all the different aspects of healthcare. Hackensack Meridian Health is at the cutting edge of it. Can you share a little bit of on the macro level of how they're approaching systems for the better health of the community? If either of you can touch on that topic from a systemic approach for Hackensack Meridian Health.
I mean, great question. From a practical standpoint, just electronic medical records. So now if a patient of mine goes and sees Dr. Sealove, I can go and access the note. So it makes the care a little bit more seamless. There is more emphasis on the mind-body connection, integrative health, mental health, and a lot more emphasis on trying to keep patients out of the hospital. So a lot of more outpatient centers, a lot of the kind of more procedures that used to be where you get hospitalized now are done on a same-day basis. And I think it's been proven to have an impact on the healthcare system as a whole, because all of us want to get, if I operate on you, I try to get you home, the next day, where normally it may have taken 20 years ago 4 to 5 days in the hospital. And I think that also leads to a quicker recovery.
Yeah, I mean, so it is a great question. And from a systems standpoint, which I'm pretty involved with, is, regardless of what hospital you walk into at Hackensack Meridian, what we do now, and is only getting better, is the level of care that you're getting as a cardiac care is the same regardless of what emergency room you walk into. And the way we are connected as a system will streamline care in order from getting a service, if by chance it's not provided at a hospital, to get it into the correct setting. But yes, the whole plan is, and what happens now is if you walk into any of the HMH facilities with something cardiac, the level of care is so high and universal and shared that your outcomes will not matter. And that's really what it's important to know.
Well, kudos to the organization. Thank you for that. So let's open it up now, Jeannie, if we can. And thank you. Therese, Executive Director of All Things Good.
Thank you so much. First of all, I want to thank everybody on the panel. Cindie, thank you again for sharing your story. I've heard it before, but every time I hear it, I feel for you. Thank you for reaching out to other people, because that's exactly, you're saving lives by doing that. So thank you for that. And thank you for everyone on the panel sharing. I have to say, I was listening to you and listening to you and listening to you, and I finally got up, I walked over to Erin, I threw my arms around her, I'm like, I need to see you. So you guys got to me today, so thank you.
That's great. My echo is tomorrow 9 o'clock. I will be there on time.
So I also want to give a shout out. I always have to give a shout out to Terrence and Jeannie Wall, because without them, these podcasts would never exist. And they're always so inspirational, informational, life-saving, and they also tackle very tough topics as well. So I love them so much. Thank you for everything.
Back at you. Thank you.
Back at you. The Monmouth Regional Chamber does about, 10 events a month? So it's a great organization to belong to.
So let's hear from the next generation.
Yes.
Of cardiologists, nephrologists, surgeons, nurse practitioners.
We have a couple questions over here.
At what age should you first get your heart tested and looked at?
There's always really
Question.
smart people in the audience, which always makes my life a little more challenging. No, it's a great question. And the answer is there really is no age there's no barrier of entry into my world, and there's no age that you should or should not see a physician. That's thing number one. Now, you do have youth on your side, so that is a good thing. I tell people that if there is a reason for you to see a cardiologist in your mind or your family's mind, and it'll help clear your mind, there's no reason that you should not see a specialist if that is going to, again, put you on a better path or just clear your mind. Now, again, as a teenager, I see a ton of teenagers, but they're usually coming with a symptom. They're not worried about their overall heart care. Although I would argue, as I said earlier, that we all should think about it even as our teenagers. I have 3 teenagers who happen to all be vegetarians and exercise 5 days a week. Now, I'm not saying I take all the credit for it, because Mrs. Sealove takes a lot of credit for it. But the reality is it does start young. Now, would a 28-year-old need to see a cardiologist? The answer is it depends on what the 28-year-old has on his or her mind. So the answer is there is no age for you to see a cardiologist, and there's no age that you need to avoid a cardiologist.
And in fact, on the Board of Ed, I was past president of the board last year, pushed for, and we set up programs to screen for sports and some of the other specific items that can evidence themselves with sodium cardiac arrest and issues with young folks, girls and boys that have absolutely no known history, and that kind of screening is critically important, and should be done every year from in every school, of course. And I know, Jim, this is the electrical piece; it's very important. But it may be cardiomyopathy, a host of different things that you wouldn't necessarily be symptomatic, right? So, but thanks.
No,
That's a great
I believe
question.
there should be legislation for that.
100%.
That mandates it for athletes and
AEDs
high
in every
schools.
school, 100%.
Yeah, that's my belief. I've stated it before. And I just have to say, Dr. Sealove, your daughter Ryan was at my house a few years ago, and I was making him jadra. And I'm half Lebanese, so it's a Middle Eastern dish, and it's very healthy. It's lentils, rice, olive oil, and salt. And the next thing I know, your wife calls me, what is it? It's called something. Your daughter wanted her to make it, and it's one of the healthiest dishes. So, like you said, they learn from example from you and your wife. So I saw that in my house, so that's great. And you have a question?
What kind of made you go into cardiology, and what's the most rewarding part of it?
Again, another loaded question. Well, my grandfather passed away suddenly from sudden death, actually, when I was in high school. So that was the thing that I was most intrigued about. I knew I wanted to do medicine, but that was the thing I was really most intrigued about. I find the engineering of the human body still amazes me. I happen to read a ton of medical nonfiction, even historical nonfiction about it, because I find it just fascinating. So I would tell anybody who is, young and say, what do I want to do for life? Something that really is intriguing and pushes you, because that's the thing that's going to make your happiness in life be really fulfilled. For me, the thing that makes me, I think most valuable in my career, and I hate to say, everybody does amazing things in this room, but I would argue that I have probably the most amazing job, because most of the time it doesn't feel like I go to work. And if you're able to say that, I think you've really made it as a career. It doesn't matter what you do in life, But for me, the patient communications and the patient relationships that I've gained are just invaluable. I mean, some of which are sitting in the room who remain nameless, but and they're just to share amazing experiences that they have, the birth of a grandchild. I've even been to a few funerals, with families, and it's just that connection is just invaluable.
Thank you very much for that. Thank you. Jeannie?
Hi, my question's for Cindy. First, thank you so much for sharing your story. That was such a roller coaster of emotions. I had chills. So thank you. My question is, how long was the recovery phase and for you to start feeling like yourself again?
Good question. It was quite a long time. I would say every bit of 9 months. Physically, it was incredibly painful at first, and that was because of the broken ribs. I mean, I couldn't cough, I couldn't sneeze, and the pneumonia, so that was brutal. In terms of my heart, and putting the stent in, that was okay. I went back, so this happened in March, I went back in August because I was having, again, shortness of breath. So my doc brought me back in for another, and they had to, there was a failed stent, so the stent had collapsed and they tried to reopen, but that part of my heart was already damaged, so it was actually okay because there was no blood getting there anyway. But my point is, so that just kind of prolonged it even more for me. We changed up some medications, which helped with the breathing. And then I was, exercising every single day through cardiac rehab. And then once I felt confident with cardiac rehab, at Jersey Shore actually is where I did that, and where I would have nurses there. So that was very helpful. But every bit of 9 months, I would say. And I still have moments, but physically good. Moments, I think, is more in my head. Emotionally, it takes a little longer to heal, but piggybacking on what Jim said, we live every day and enjoy every day. So if it's beautiful out and you want to, and normally, like if we said, you want to take a walk, you want to take a drive down the shore and walk on the boardwalk, and I might have said, oh, no, I've got this to do. Now I go, yeah, let's do it, And that's what we do, and that's how we live our life, and it's good.
So Cindy, as we close out here, what would be your key messages to folks leaving here? You just shared a couple of them, and any big things that are coming up that you wanted to share yourself. I'd like to hear also from James and our doctors here as well.
Going forward, just listen to your body, trust your gut, trust yourself. I think I trusted what I was feeling. I didn't know what it was, but I trusted it. And I always will do that from now on, and I tell people to do that in terms of women and men, but just be on top of your health care, be on top of, on your stress level, be on top of exercise, emotional things, keep stress out of your life as best you can, and live every day, because tomorrow's not promised, and enjoy every day.
Thank you so much for that. It's really being comfortable at being aware.
Yes.
It's okay, be aware. James?
You need to be prepared for bad things. It's just all there is to it there. So we put seatbelts on, thank goodness. We know what to do if a fire alarm goes off because we were trained to do that as kids, and that's instinctive there. But do we know what to do if somebody collapses in front of us? So think about preparing yourself. Think about taking a CPR class. Think about getting some equipment for your work and your home. Just if that event happens, you have the knowledge and the equipment to go ahead and take care of it. And most important, you need to hug more. So do that on the way out, at least here after this podcast today.
Thanks, James. How do people reach your company?
TeamLife.com. We're located in Colts Neck. I have the 3 other classrooms. I have one North, Central, South Jersey, and I'm blessed to work with great people across the country now getting this message out.
That's corporate and public CPR training, AED training, and implementation, correct?
Absolutely, and all the sales of things that you need to keep yourself safe.
And I'll just add to that, after this, my husband, who knew nothing about this, went and took a course, and we do have a defibrillator in our house from Jim, so thank you. So it makes me feel a little safer.
Dr. Sealove.
Well, my parting words are, it's really all about prevention. You don't want to end up on either of our tables, and you don't have to. It just takes some work. It takes a lot of work. And it doesn't mean that the cheeseburger and fries that you'll have on July 4th is not permissible. You just don't want to, I would say, increase the behaviors over and over and over again, right? You could break the rules, you just can't break them too often, and you can't fall off the cliff when you break them. And so it's not here to scare you. It's actually, my twist is more uplifting than anything, is that you really have the ability to change your outcome, or to improve the chances of your outcome. And yes, there are things that are not in your control, not in my control, genetics being one of them. But boy, I'm going to take every piece of my puzzle and optimize that puzzle so I could live to the future as long as I can. As you mentioned, hugging people, emotional connections, and being happy, because you only got one trip here, and you better make it, again, fulfilling. So I those are my parting words.
Thanks. And how do folks reach your firm?
The Hackensack Meridian Health website is probably the best way to get me.
Perfect. Thank you. Dr. Hanhan, now is there going to be
Okay.
fattoush, lebni, tabbouleh, lots of healthy food we can talk about?
Oh, yeah, the Mediterranean diet. That's it, Mediterranean diet. No, for the young people, I think what Brett said is absolutely on point, which is find something you're passionate about. It doesn't have to be medicine. But if you're passionate about something, then I don't feel like I go to work. I don't feel like it's work. It's really kind of a mission. And also, if you do end up in a medical career, the things that we experience as physicians that I think a lot of other professions don't experience is heartfelt gratitude. I mean, when I do a lot of lung cancer surgery, and you'll see the patients post-op, and just that connection when they're so thankful, it's almost like I would do it for free. I don't know if my wife would like that, but anyway, so it's almost like that gratitude alone is really something that if you do end up in a medical field, I think it's just something that's really special.
Thank you so much for that. Folks, how'd we do today? Did we do good? I want to thank everyone for being here. I want to thank our guests for being here, and our Monmouth Regional Chamber of Commerce, and of course our sponsors, wisp.io. Get the QR code from wisp.io.
Yep.
Jeannie, did I miss anything?
Quick group picture.
Oh, yeah, thank you.
So the guests can stay seated. We're going to get behind you. Oh, hold on one second.
Okay, so on your tables, you see this little banner. We're going to make it a big banner that's going to go behind the panel, the panelists each month. So if you want to get your logo on the banner, and we're going to be using it for a whole year, come and see Gail or myself. Thanks.
So again, I want to thank all the folks that were here in the audience. Really appreciate it, and especially our guests. I think you're saving lives by being here. I call it the ripples in the pond, and I've seen it happen, and I've heard the stories, so thank you so much. You made a huge difference by being here today, and Bell Works, and thank you to Ralph Zucker and his team at Somerset. Thank you, Jeannie. Thank you, everyone. And let's have a group picture, if you don't mind, real quick. And I want to thank Ming Chen, Gary, and our podcast to the stars right there. Shared Podcast Universe. Shared Universe. Thank you, folks. Okay, we're ready.